Well, Dr. Herman, big day tomorrow. The first group coming back since the surge in cases in Aotearoa. What are the plans? How are we going to handle this?
Well, we've done quite a bit of work this week since Cabinet approved for passengers to come on this flight tomorrow, and it's been quite a marathon for all of us in terms of meetings and ensuring our preparedness, firstly within Te Maraeora, knowing that we are the lead agency, and we do want to ensure that we have covered all our bases and ensured that we have protected our population here. There's also been the meetings and engagements with the border agencies. As you know, since we went COVID-free in April this year, we've been very clear about protecting our border, and so some very important meetings have been held with our border agencies, and as well as that our puna, because in Rarotonga the puna hold the areas and communities, and the 10 of them in Rarotonga are so important. At this point in time, we also have our community health clinics located within all of the 10 areas in Rarotonga, and it's been the merging of these agencies and leads and leaders to make sure everyone is on board. We do have more work to do in terms of communication to ensure that the rest of the general public understand what processes have been put in place to protect the population here. And on top of that, of course, is the work that we've been doing, engaging with the passengers that want to come home. Many of them have been away from us for quite a while and really desperate to come home.
Look, talking about coming home and talking about on board, what do they have to have done before they can get onto that plane tomorrow?
Well, there are two main health requirements, and the first one is that they must have a negative COVID test, and many of them have had their test done, and today we are just checking and finalising those that have provided their test results, which should be negative. If people do not have a test result, they will not be allowed to board. Te Maraeora will not support or recommend to immigration to do that. The other one, of course, is ensuring that we have secured or approved a supervised quarantine residence for them here in Rarotonga. So we've been beginning that process yesterday and talking to the family members that have organised their residence when they come here. There's a third health requirement which will occur at the Auckland International Airport departures terminal tomorrow, where they will have an exit health clearance. This is provided on behalf of the New Zealand Ministry of Health, and if they pass that, then they will be able to go forward and check in and board the flight.
When they get here, of course, they're not going to go through the normal process of coming through immigrations and customs and coming out. You're going to keep them in there, then what are you going to do with them?
Well, on the flight, they will be wearing masks. That will be mandatory, and New Zealand has confirmed that. And on arrival here in Rarotonga, I will be getting onto the plane to speak to them prior to them disembarking. I understand police will also join me, because I think it's very important that they understand the reason why we are undertaking supervised quarantine in Rarotonga and the need for them to comply with these requirements for the benefit of the people of the Cook Islands. And so we will be communicating that very clearly tomorrow, and then they will disembark and come through to arrivals.
Then you'll take them through to the pre-approved accommodation that they have to go to, houses or wherever it is.
Prior to that, when they come through, just before they enter the arrivals hall, they will have their hand luggage sprayed or wiped down with disinfectant, and then they will enter and provide the health declaration card to ensure that none of them are symptomatic or are having any kind of illness or been in contact with someone with COVID previously or recently, and then they will come and get into their immigration queue, pick up their luggage, pass through customs and biosecurity, and then they'll exit the departures arrivals terminal and go straight into their pre-assigned bus. Government is providing transportation for all of the arrivals so that they go directly to their homes. We will have our lead nurses for each of the 10 community health clinics on those buses as well, so that we are very clear and begin that relationship and engagement with them.
Now, you're going to require them to self-quarantine for 14 days. We've seen in New Zealand where some people struggle with that. And, I know that what happens if somebody doesn't play by the rules?
Well, we have an act, a COVID Act, and we're very clear about this. I have issued the category quarantine order, which states that all persons coming off this flight must go into supervised quarantine. That's clear. And if they should breach, then there's the risk of having a $10,000 fine or imprisonment. We have also just this week identified a motel that we will prepare in anticipation, or should someone decide to breach these quarantine rules, we will place them in this particular motel.
And they'll start again?
And they will start again. And I think this is the thing about it, that with COVID-19, there are many things we need to be mindful of, and for the passengers coming home, as much as they have missed this country and their families, they must understand that we need to do our best to always find ways to mitigate and minimize the risk of them bringing COVID-19 into this country. We have too many precious families and vulnerable persons in this country, and we need to protect them from COVID-19.
Cook Islands is one of the very, very few countries in this world that has not had a COVID-19 case. Can you spell out to us how important that is, and how do we go forward trying to maintain that?
I think for us, it's a privilege in COVID-19 to have kept ourselves COVID-free, because we see what it does to other countries and takes away the liberties of many people to move safely. And we understand now how important it is for us to protect what we have and to continue to find ways where we can continue to travel to New Zealand only, and yet continue to keep our people free. And we don't always have all the answers, and we rely a lot on our people to guide us as well. But I think it's important for us to use what capacity we have in the country to help inform some of these decisions. But we learn a lot from what's happening in New Zealand, from other countries that have done very well to mitigate COVID-19. So many lessons to learn, and many reasons why we need to do our best to protect our population.
Now, with this flight coming in tomorrow, it could be the first one of one or two or several, and there's a great responsibility on the people coming in. But there's also a responsibility on the families here too, isn't there? What have you got to say to them?
I think for our families here, we need to have patience. We need to understand the risks that are involved. It's not worth it if we have COVID-19 come into this country. Te Maraiora and our border agencies have worked very hard to mitigate that risk, and we now ask just for 2 more weeks. We've brought our loved ones home. 2 more weeks, that's all we ask. Just hold and support the quarantine process. Let's not undermine this process, because after 2 weeks then they can join the rest of us in this country.
Minister, there's anxiety in the community. I'm sure you know that. People are concerned, they're not quite sure, they're a bit afraid. What assurances and confidence can you give them about the arrangements for this flight coming in tomorrow?
Me taki kia ora ana tātou katoa te iti tangata e karokoro mai nei tō tātou awata tutu. Ki te nei mātou te ngā rāne, tō tātou iti tangata te manamana tāne, te taitai ane, no tō tātou iti tangata rai ku ki arani o ki mai nei ki tō tātou pāsirea, āpōpō. Hina, ke tātou te iti tangata, ko rawe ana te o ipanga, te naurani o te orongai te akamita ki tō tātou maine akatere o te Maraiora. E pera katoa, te iki ki roto i te kumiti, ko rātou te rawe nei te uriuri anga manako, e pera katoa te kawamani, tā tātou cabinet, Mātou te turuanga I te au tamanakoanga te ka tukunea mai, te urianga I te au manako, te ka riro mitaki no tō tātou I te tangata. Te ka riro te irina ki nei mātou ki roto I te au tamanakoanga te tukunea mai, me roto mai tō tātou kopapa, te kumiti ko the National Emergency Health Task Force. Kia tātou I te iti tangata, ko te patianga I konei, tātou te kōpū tangata, pera katoa tātou I roto I te au puna, kai nauru I tātou ki angang kapiti no te ia, iti tangata no tātou I uki mai nei. No te mea ko rawe ana tātou, I te ia tātou I topa ake nei, ko ki te ia te vairua o tai roto pu I tātou I te iti tangata. Ko te vairua rai te ano e nei no tātou ki marama tātou, I te au tūkaui, te kāroko mai me kāre tātou E aru I te au takaianga te patia ki tātou, te oronga e mai, me roto mai tō tātou marae ora. Tō tātou tae ke tere mai nei, ko ki te rātou I te au akateretereanga, I te au patianga, te au akaueanga, te oronga e kia rātou. No reira, ki aru rātou I te ia. E pera katoa tō tātou kupu tangata, koto e au kupu tangata tō koto I roto I te ia. Au I te tangata ka tae mai, ki aru katoa koto I te au patianga, e te au akaueanga, te oronga ia kia koto. Me tae mai tō tātou tae ki apopo, ka tae atu rai tō tātou mai ne akatere, Dr. Herman, te pai ki runga I tō tātou pairere. Ki roto pui tō tātou iti tangata te ka tae mai, I te akakitea kōtu, I te akamarara kōtunga, ki a rātou, I te au takaianga tā rātou ka aru. I a rātou ka tae mai, ka takai mai ki runga nei tō tātou inua. No rira te irina ki nei au, te irina ki nei katoa te kaumani. Ko te au akateretereanga, te au akanonoanga te irawe ia, ka riro te rira, e mea mita ki te ia, ka pāruru katoa te ia I tō tātou I te tangata. Ko ki te katoa au, I tō tātou mama ariki waine tino mana, te aronga mana I roto I a pua I kura, au tūranga te tai, ua maanga tukau I rātou, I nā rā ko te reira, te aka nono I na kone I roto I te tai urianga manako. Me tā te maine akatere tai kuara, te waine te au tai te irina ki anga no runga I te karere, te kaweanga karere, ki roto I te au puna, ki roto I te au tō tātou iti tangata. Pēnei au ngai tūkau I te ia, haere tai ana te karere. Ina, ko tā mātou te o te akanono, I te uri, I te ia aura, te anganga pakari nei tō tātou aronga anganga, kia ki te tātou I te iti tangata. Te anganga pakari nei rātou I te raweanga, I te au tuanga, te au ngai rikiriki, te au tuanga, kare tātou I kite ana, ko oti rātou I te io maari, ma te matakite, I te kia tere mitaki, te tōanga pairere te kātaime kia tātou apopo. Tēnā kua karonga tātou I te au tūranga, no tō tātou tae ke me roto mai te pairere, tae o atu ki tō rātou ngutuare te akatakaia. Ko te au ngutuare te akatakaia, kāre te au ngutuare I te mea, nā aurai iki tō tūranga pāpu I a koe ko te tō ngutuare. Au takaianga te tai, nā te marae ora rai, ariki te au ngutuare me kua tau, no koto no tō tātou taeke, kia no ki roto, no te tuatau tai ngoruma a rā. I a rātou, akataka ke ia nei me roto pui tātou te iti tangata. No reira, ko tere rā takaianga, kia rawe te ia, pera katoa, I mua ke kākatikai a rātou I te kake ki runga I te pairere, kia pāpua tō rātou au test, kāre rātou I tui a te maki, me kāre te tai o atu o te tangata I test ia, me kāre o results tai mai, I mua ke te pairere karere, aka koromaki mai tātou te iti tangata, koto tikai tāpapa nei no te uki mai, no te mea kāre koto aka tikai ia, kia takai ki runga I te pairere, no te uki mai ki te inua nei. No rira te iti tangata, ko te ia te au anganga te ia, rawe pakari nei tō tātou anau, tā te marae ora, pera te task force, te iki ia. Tātou I rarotonga nei, pera katoa tō tātou iti tangata inutireni, te au tuanga, tuke, I te anganga kāpitianga, kia tere mitaki mai tō tātou iti tangata ki tō tātou pāsireia. Kāre rā mi te mea kua rawe viviki o te anganga, kua nāroto I te au takaianga, I te karokaro matatioanga, kia mānea te au nganga kātotoa no te mea, ko te numero tai, I roto I te ia, ko ioki kia paruruia, tō tātou pāsireia, tō tātou iti tangata, kia kore rawa te ia maki. COVID-19 e tai mai kia tātou. E te e toa taurira te ano nei au, te oronga i te akamitekianga ki tō tātou iti tangata. Kia koto e tō tātou iti tangata kā toa. Ngā tuanga e toru o tō tātou nei pāsireia, tātou tika e runga ni e tumu te warawaro, e pera koto i te paenua. Te akamitekianga rānunui me roto atu tā tātou kawamani, e runga rawa atu me roto atu i te marae ora, e te ronganga kātotoa tō tātou maine akatere. No te anganga tāokotai e te wairua okotai, te kite e rutupu e tātou me te tuatau i akamata e tātou i te tomo nā roto i te maki. E te era e tātou te nā roto nei te ia. Kāre tātou i atea ke te ititangata. Nā rā, ki akamitaki e te atua, e ka akamitaki ora e tātou i tō tātou atu. No tāna tiakianga e tāna pāruronga e tātou. Tō tātou evangeria, te au ekaresia tuke i roto tō tātou pāsireia. Tō tātou tango, tina mō teia, e kia vaira e tō tātou irinakianga, ki roto tō tātou atu, e koia tō tātou akaora, mō. E irungara wātu, te oronga maianga, e te marama, te kite, te pakari, ki tā tātou anō e rawene i te anganga, o te pāruruanga, te pāruru pakarianga, i tō tātou pāsireia, kia kore rawa, te ia maki, e taimai kia tātou. E irungara wātu, ki tō te enua, te uiariki, te kaumai tinui, e te ronga mana kā toa tō tātou nei, enua e tō tātou pāsireia, no tā kōtou tuanga pōpinga katoa, i te pirimaianga, i te ruru okotaianga, i te ngai okotai, no te e tā tātou, e tomo nei nā roto, e tā tātou kawani, i te turu katoanga. Ngā tuanga e toru te ia, tuanga pōpinga te ia, i roto tō tātou pāsireia, e pērā katoa, tō tātou aronga anganga kimi pōpinga, e te iti tangata kātoa. E reo patipati te e ke tātou, no tō tātou tae ke tae mai ni apopo, ki angang ka piti tātou, i te pāruruanga i teia, no te mea iti tangata rai teia no tātou. Kāre tātou e te apai mai nei, i te iti tangata me wā mai, me kāre ara iti tangata no te tai enua ke mai. Māri rā ko tō tātou iti tangata kuki arani, irina ki oku ki te tātou i te au akateritereanga, te nāroto atu i te au karere, e tukuna ia nei kia koto e te iti tangata. Ko rātou te uki mai nei, kia tākawe tātou i a rātou, auraka rā nāroto i te imātau i a tātou, kāre tātou e te kopu tangata, e te iti tangata i a katika i a te ārāwe i tō tātou taiake, kia tairoa, ki te tuatau, e ātea mai e nā rātou nōroto, i te tūranga o te taingoro mā ārā. No reira nā te atua tātou kātou e tauturu mai, kia orana e kia manuia.